Now, let's start with this, ma'am. What is the current state of mental health in Canada, and how many Canadians are impacted, especially considering that we're in the fourth wave of the pandemic?
Well, it's not good. So we know that in any regular year, about 1.6 million Canadians have unmet mental health needs. But because of the pandemic, that has gotten even worse. So we know that 40% of Canadians have said that their mental health was impacted, with 48% saying that they've had an increase in anxiety and worry. And that's worse for children and youth who've experienced things like eating disorders, depression, and anxiety. We know substance use is up, opioid use is up, and opioid deaths are up. So Canadians have really suffered during this time.
And we know there were multiple health emergencies, mental health emergencies in Indigenous communities. Can you tell us a little bit more about this and other communities that may have been hit hardest by this mental health crisis?
Yes, Indigenous communities were hit very hard. We were seeing youth suicide going up, and we know that 54% of Indigenous people said their mental health had worsened during this time. That was true for other vulnerable populations that we looked at as well. So all of these groups, including people with a pre-existing mental health condition, people with disabilities, the LGBTQ population, the unemployed, young people, all said that their mental health had gotten much worse, even worse than the average Canadian had indicated.
All right, ma'am, just over 2 minutes now, but we know the CMHA is calling for federal parties to make mental health a top priority in this election campaign. Where do the main federal leaders stand on this issue so far, and what are your thoughts on their platforms?
Well, we've been so pleased to see the response from the federal parties. All of them have indicated that mental health is important to them. Notably, as you mentioned, the Conservative Party of Canada has identified mental health as one of their top 3 election issues, which was thrilling for us. They're going to increase health transfers to the provinces and territories, provide more support for community mental health, which is great. Similarly, the New Democratic Party is proposing free mental health care for all, as well as universal pharmacare. The Liberal Party of Canada, we're still waiting on their actual mental health commitments, but they've already reconfirmed their commitment to reducing healthcare wait lists, providing more funding for healthcare providers, and we know that their budget in 2021 was very strong on mental health. So we know Canadians understand the importance of mental health right now, like they have never understood it before, and it seems that the federal parties are really listening and responding.
All right, ma'am, let's take a look at the current healthcare system. What would you say is currently missing in the way we handle mental health cases in Canada, and what are the gaps that need to be filled?
Well, it's a very difficult system to navigate. And most Canadians end up going to their family doctor if they're experiencing an issue. But often even those doctors don't know how to navigate the mental health care system. And unless you have a very acute need or an in crisis, that it can be very tough to get care. And even those people have a hard time if they're in rural or remote communities. So we know that 85% of Canadians think mental health services are among the most underfunded services in our healthcare system. So we know that there are places that need to be fixed. So what we want to see is there are things like basic mental health care services that are not covered under our universal healthcare system. And these are things like addiction programs, psychologists, social workers, peer support workers, or things like treatment programs for personality disorders, eating and mood disorders. Most G7 countries have supports for these things. Those treatment programs are free. And while some employer benefits cover some of those costs, that money can run out pretty quickly. So we really want to see this larger investment in mental health to really fix this system and address the deep needs that Canadians experience.
All right, Ms. Eaton, always great having you on Forum Daily. Thank you again for joining us today and sharing your messages with us.
Thank you so much, Nima.
All right, don't go away. We've got top national headlines coming up after the break, so stay tuned. We'll be right back after a short break.